Today, I'm talking to Giri, Madhavan and Emma Redding, and what we're talking about is consultation with patients with learning difficulties.
Well, particularly with our clients with a learning disability, they may have problems with their attention and concentration. So focusing on a video consultation would be quite difficult for them to do. So we need to kind of consider what things are going on in the background. And also they might have problems such as needing extra time to process what's said to them. So the verbal message sometimes can be quite difficult to kind of follow along and also to retain. So giving too much information in one go could be a problem for them.
In terms of our GP colleagues, where the consultation has changed dramatically, tell me a little bit about the difficulties that you think they may encounter.
Perhaps the main bit would be adapting to using a video rather than in person. So that'll be completely different for many of them. Many of them would have come to appointments perhaps with a carer that would have been arranged with a lot of preparation. Video consultations is something very new. It's being imposed in some ways because of the situation we are with the pandemic.
Thinking about the timing, so having longer appointments, doubling the appointment time to allow for that slow processing, using simplified language as well, trying not to use too jargonistic terminology, because some people will have difficulty with kind of abstract language and things like that. Thinking about the way that you're phrasing your questions as well, so using quite closed questions rather than open, and giving people fixed choices and options to choose from, so potential symptoms could be helpful as well. And also kind of making the consultation as visual as possible. So any photos or pictures or models that you have in your office that you could show over the camera would be really helpful.
What are the tips you would give GPs for dealing with patients with autism?
With autism, so for example, making sure the appointment times, if possible, so ideally first time in the day, if possible, so they're not waiting. So it will be a virtual waiting area, but it will still have the same impact on that person. If they're expecting a certain time, and let's say you're running late for whatever reason from a previous appointment, a minute can seem like an hour. Now, someone with autism, their baseline anxiety is much higher than us. So having to wait is going to be quite an issue for them. So for autism, that's one thing. The other bit, so if we're talking about neurodevelopmental disorders, which are quite frequent with people with intellectual disabilities, but specifically for ADHD, for the clinician, it's important to not be too fazed by the distractibility of the individual. So they may not be always looking at the screen. With a remote consultation, generally you'll be quite fixed on the screen and you'll notice things that can be actually quite distracting for you as a clinician, but just accounting for that, it's nothing to do with you, or it's nothing to do with the individual, it's just how the interaction is very different.
In terms of consent and patients with learning disabilities being accompanied by someone, we were able to get over that in a normal consultation. Are there any particular problems in a video consultation?
What I would suggest is it's mainly implied. The first thing for any individual is for the GP or other clinician to work out, actually, is a video consultation needed? Could this be done on telephone? So I think that's pretty important as well, because some people may find this quite intense and prefer a telephone. And it's about the clinician sort of working out, well, can we do this by telephone if that's what the individual wants? Or do we actually need to do it by video? Or do we need to do it face-to-face? So all the questions that you would normally ask yourself, you would still be asking before all of this.
Today I've been talking to Dr. Giri Madhavan and Emma Redding about the difficulties of running video consultations with patients with learning difficulties. Thank you very much, Giri and Emma.